Hi there, it's Dr. Mike Garrett with DirectMD Austin. I'm a family doctor in Austin, Texas, and I'm getting ready to process a couple of coronavirus Corona Check antibody tests. These are in-office point-of-care tests. We just do a little finger prick of the patient and collect a small amount of blood and then do these tests, and I'll show you how the kit works. So we have an alcohol swab. We just wiped the patient's finger. I collected these just a minute ago. We have a little lancet that when you press on this, it pokes the finger, and then you get a capillary tube. See if you can see that basically collects a little bit of blood in that tube. And you put the specimen on a little cartridge like this. You can see where that is red. That's the specimen well where I've already put some blood from this patient. And then we put the buffer solution down in this part. So it's just a little tube like this that has a solution. I'm gonna drop it, 2 drops in that little well, and we'll have results in about 15 minutes. Same thing on another specimen here. Open the buffer solution, drop 2 drops in the little buffer well, and we'll have results in about 15 minutes. Okay, while we're waiting on those results, which take at least 10 minutes and should be read before 20 minutes, so I'm just doing about 15 minutes on those. I'm just gonna review a little bit of information from the package insert on this test with you. The test is an IgG and IgM test. It's done on whole blood, and the sensitivity for IgG is reported at 100%. With a confidence interval of 96 to 100%, and the specificity for IgG is reported at 99.5%, and the sensitivity for IgM is reported at 91.8%, and the specificity for IgM is reported at 99%. So, and that's with about 450 specimens being tested. They report those kind of sensitivity and specificities. Of course, we're going to do some internal testing here with known positives and negatives over time to develop our own kind of data and make sure that this test is as accurate as they claim. I've seen other things to suggest that these sorts of tests probably going to be around 90% in terms of the sensitivity and specificity. So we're gonna validate that ourselves as best we can with our own specimens. So just wanted to give you that little bit of information while we're waiting on the test results. It seemed like there was one other thing I was going to say. Oh, this is a point of care test that's done in the office. Collect a specimen either in the patient's car from a finger stick of the blood specimen or in the office with the patients in the office. And we'll get results, like I said, in about 15 minutes. It is a whole blood, and it is detecting antibodies to SARS-CoV2, which is the virus that causes COVID disease. And it's a rapid chromatographic immunoassay. So basically it's an antibody test. This is different than the swabs that we do in the nose that are detecting the actual virus itself. I'll be back. So basically it's been 15 minutes. We put the buffer solution in here. There's the blood, capillary action carried it up. You can see a little line here that shows the control line that is positive, and there's no line at the IgG or at IgM. So this is what a negative test would look like. Of course, that has to be clinically correlated with your medical judgment with what the other testing has shown, and we're gonna have to try to validate the results of these over time, but it's that simple. Okay, so just a couple of comments to wrap up this first video on the Corona Check IgG and IgM antibody test. This is a test that's done on a finger stick, whole blood, in the office, get results in about 15 minutes, and we're in the process of validating this test. I want to make clear, we're not offering this test to the public right now. We're doing this test internally on specimens and on known positive and negatives to try to determine for our own patients when this test will be valuable, or if the test will be valuable, and what its accuracy is. The other thing I wanted to say was I noticed from watching the other video that you can't see the control line really well. So I'm just going to use the other camera. I'm going to try to flip this around and use the other camera, or get a better, it looks like I can't flip the camera, but I want to try to get you a view of the control line is positive. When I watched that video, it was not evident that the control line is positive, and it does fade a little bit with time. Let me show you another one here. There's definitely a positive control line there. It just was not that evident in the other video, but you can see the little line there. It doesn't show up as well on this camera, but it's clear. So, okay, thanks for watching.